and ask the other folks connected with this program to briefly introduce themselves, and then we'll move into the discussion for today. My name is Craig Cohen. I'm a professor of obstetrics and gynecology at the University of California, San Francisco, and I've had the pleasure of living and working in Kenya from 1994 to 2002, and continuing to collaborate mainly with Professor Bukusi, who's also joined us at the Kenya Medical Research Institute, and predominantly work in Western Kenya and the previous Nyanza region. Sherry, do you want to introduce yourself?
Sure. I'm Sherry Weiser, a professor of medicine in the Division of HIV, Infectious Disease and Global Medicine at UCSF. And I've been doing research related to SD4H themes like food insecurity, other material need insecurities, gender disempowerment, and other topics since 2001, both in the US and in sub-Saharan Africa. I've been working in Kenya for the past about nine years. Looking forward to working with all of you. And Craig, I'm wondering if after we finish, if we want everyone to just state their name and what department they're in?
We'll take a lot of time, and we only have 1 hour. I think we have that information already. Rhoda was able.
I just mean one word, name, just name, so everyone knows each other when they're talking.
We'll see. I'm just skeptical of time. Elizabeth, maybe. Elizabeth, sorry. Sure.
Am I to introduce myself, or am I to make a comment on introductions?
Both.
Maybe I think Sherry was suggesting at the end, not maybe at the end of the introduction of the faculty, but perhaps at the end of the seminar. Maybe people could then say who they are and where they're from. I think that's what I heard Sherry say. My name is Elizabeth Bukusi. I work at the Kenya Medical Research Institute. I'm also volunteer faculty at UCSF, and I'm also a research professor at the University of Washington. And I'm happy to also say I'm adjunct faculty along with Professor Craig Cohen, which he forgot to say, at Maseno University, the Department of OBGYN.
True, very true. And then also Rachel Berger. Have you said hello, Rachel? You're on mute.
Welcome. I'm excited to see everybody here. I'm Rachel Berger. I'm helping to support the D43, the Sustainable Development for Health, as well as other research projects in Kenya.
And then Rhoda, I presume everyone knows you, is that right? Okay.
Hello, I'm Rhoda Musungu. I'm the training coordinator for SD4H at Maseno University. Thank you.
And then the other person who unfortunately is not able to join at this very moment due to the blackout in Kisumu is Luis Ndunyu, who's probably well known to all of you, faculty member, chair in the Department of Epidemiology at Maseno University. So we're very excited to bring this group together, and we'll have you introduce yourselves at the end. Is that okay, Sherry? You can just start.
That's fine.
Yeah, I just want to make sure we have enough time to go through the material because we only have an hour total. We're very excited to get this seminar series launched. As was maybe mentioned a little bit earlier, so we have a collaboration between Maseno University, School of Public Health and Community Development, the Kenya Medical Research Institute, and the University of California came together to address this topic called Sustainable Development for Health. And because where the monies are coming from, it's HIV money, we're focusing on HIV health, HIV care and treatment and prevention outcomes, and how they relate with sustainable development. We put together this concept because, and this is a very transdisciplinary concept, because we've been working in this field, as Sherry mentioned, Elizabeth didn't mention, but we've been working in this field for a very long time, for well over a decade, and we noticed that we were having a hard time identifying young researchers in Kenya who were working in this field, that people were traditionally trained in epidemiology or in public health or medicine or nursing, and then in the development sciences, development economics, agriculture, nutrition, and so forth, but that the disciplines didn't necessarily come together to address these issues, which are relatively complex, but also interrelated. And so as a framework, we decided to base the grant and the training program on the Sustainable Development Goal, the UN Sustainable Development Goals, which were approved by all 193 countries back in 2015, with the goals then hopefully coming to fruition in each country around the world by 2030. And I sent you we sent you the link to a brief video. We also asked if you had time to look for other YouTube videos and other materials. Obviously, there's a growing vast literature on this topic. There's 17 SDGs, which obviously is a large number, much different than when we had the MDG period from 2000 to 2015, which many of you probably are aware of as well. I'm going to share one slide now just to give you a concept about what this program is about. This seminar series, for those of you who are joining for the first time, it's going to be every other week, and it's going to be a 2-year rotation. So we have we haven't even developed, well, we have not yet to develop all the material, and also we will be asking for students to take part, because you're graduate students, some of you are faculty as well. We're going to be asking for you to also take part, and today we're going to be hearing from two of our PhD students, be talking with us about 2 of the SDGs. But it's a lot of material to cover, but we're going to cover it over essentially about 50 sessions, but over a 2-year rotation. And then we'll start the process again over the next 2 years. So I'm going to share my screen and share with you a slide. So this slide really encompasses the concept of SD4H, Sustainable Development for Health, and with our focus on HIV health. So for those of you who are familiar with the SDGs or becoming familiar, will know that SDG 3 is solely focused on health and well-being, good health and well-being. And the notion of this program is that each of the other SDGs from 1 to 17, without 3, of course, so the other 16 SDGs also are interrelated with health. So for example, SG1, ending poverty around the world. Certainly, we know that there's an inexorable link between poverty and the various mechanisms for ending poverty through livelihood interventions, for example, that we know have direct impacts on people's and communities' health. Similarly, SG2, ending hunger, and we talk a lot about food insecurity, and we'll be having talks on that, I think, in January on food insecurity. We know that food insecurity, which is really a social construct, incorporates nutrition, but many other aspects, are inextricably linked with health outcomes. And a lot of our work, a project you'll be hearing about, I think it's in February, about Shamba Maisha, which is a project that's taken place. Can you please put yourself on mute, who's ever speaking? Hello? Can you please put yourself on mute? I hear a squeaky chair. Yeah, thank you very much.
Craig, Rachel should just mute everybody else who's not talking as a host.
Oh, okay. Rachel.
So please mute or make me a co-host and I'll help you mute people.
Unmute myself. Okay, there we go. So as I was saying, as we move towards ending hunger, we know that food insecurity, ending hunger, will also lead to improved health. And the Shamba Maisha project, which Professor Bakusi, Sherry Weiser, and I, and Rachel, and among a large team in Kenya, have recently concluded a study called Shamba Maisha, and you'll be hearing about that as a case study to understand about how this agricultural livelihood intervention was poised to improve health outcomes, HIV health outcomes, as well as mental health, but also through decreasing stigma, improving gender equality, et cetera. And we could go through each of these and start to take it apart and try to understand what could be the potential implications of addressing the other 16 SDGs. We probably could focus on several that are most pertinent to Kenya and the East Africa region, like poverty, ending poverty and ending hunger. But similarly for SDG 4, which is ensuring high quality education for all people, is very important. In fact, I would conjure that the policy that was set in the mid-90s when I was living in Kenya, which was to increase the proportion of Kenyans, young Kenyans, who would go to secondary school, and specifically to increase the number of girls who were going to secondary school and graduating from secondary school, may have actually been one of the best policies that the Kenyan government made it during that time. That was under the Moi administration, to actually improve health and decrease HIV acquisition among young girls, especially in the Nyanza region. In fact, there's pretty good data that suggests that girls who are in secondary school, complete secondary school, and do not become pregnant during that period of time have a very low risk comparatively to the girls who do not complete school and get pregnant for HIV acquisition. And this was during the time when HIV is still a huge issue in Western Kenya, but during a time where over 20% of 20-year-old girls or young women were infected with HIV in the Nyanza region. So just trying to understand how improved education. So the goal of this program is for you to start to take apart these various concepts to understand the linkages to health. I think all of you are interested in health outcomes, and to see how this sort of concept around the Sustainable Development Goals could be incorporated into your work. So even if you're an epidemiologist or a nurse epidemiologist, you might want to, and you're interested in a specific population, perhaps children and issues around intestinal illness, or perhaps whatever your area of interest is, or maybe around HIV prevention or HIV care and treatment issues. Our hope is, and the reason we put this program together, is that you start to identify with one or more of these other SDGs and start to become familiar and even expert in them, and start to think more broadly around the construct of health and how these other issues around sustainable development can aid in your work, aid in your research, and eventually lead to a healthier, more prosperous community, country, and region. And do that through your academic work, and of course, add that into your teaching of the next generation of scholars in Kenya and beyond.
Can I add one point here about the link between health and these SDGs? And I don't know if you're going to get to it, but the same way Craig has been talking about how all of these SDGs relate to health. And one could also view a vicious cycle, because poor health then goes and feeds back into worsening all these SDGs, leading to more poverty, more hunger, less kids getting a good education, more gender disempowerment, et cetera. So this can be really viewed as very bidirectional.
Thank you, Sherry. Yeah, I mean, there's work that a colleague of ours has done in Kenya at AMPATH, Harsha Therimuthi, which demonstrated earlier in the HIV epidemic that those people with low CD4 counts were less productive economically in their businesses, and that adversely affected their ability to pay school fees, which then would affect obviously SDG 4. So these are all very interrelated, and we want you to this is just really a very short course. There's, again, as I mentioned earlier, a very much growing literature on this topic, on these topics. And the good news is also is that the whole world is being held accountable. Every country is being held accountable. And within Kenya, it's under, what's it called? The 2030, I'm trying to remember what it's called formally within the government, the Vision 2030, I believe, right, Elizabeth?
Vision 2030.
Yeah. So it's been incorporated into the policies of the Kenyan government at the highest levels, and working with academic institutions, working with the NGO sector, and of course the government itself and civil society. It's going to take all of these partnerships together in order to be able to address the need, do the studies, the research that's required, advance the policy, and eventually attain or surpass these goals. I thought from a historical perspective, I'm trying to get out of my PowerPoint unsuccessfully. There we go. Okay, I thought it would be good. I know you watch a short video. I just wanted to watch another short video from Jeffrey Sachs. That's not it. Jeffrey Sachs, he'll introduce himself. He's very well known, and in fact, the Millennium Development Villages, there's one in Siaya County, is under the Earth Institute, which is at Columbia University, with their local collaborators. I thought it'd be useful just to get a historical context for the Sustainable Development Goals. And again, this is from a course. If you're very interested in this subject, there are lots of these MOOCs, these free online courses. This one, we'll send the link out to you through Rhoda. It's through EDX, whatever EDX stands for. And they have lots of courses and SDGs. This is one I found online. You can sign up for it for free, and you can take the course at your own leisure.
In this chapter, I will discuss the origins of the Sustainable Development Goals. How did they arise? Why did the United Nations member states, the governments all over the world, decide that at this time we need Sustainable Development Goals? The core idea is to set clear goals to help orient the behavior of governments, of businesses, of each of us as citizens, as students, as researchers, as activists, as consumers, so that we're pointed in a shared direction. This is the idea of goal-based development. And I always think of the wonderful observation of a great American leader, President John F. Kennedy, when he talked about the importance of setting clear goals to help move a society forward. He said that by defining our goal more clearly, by making it seem more manageable and less remote, we help all people to see it, to draw hope from it, and to move irresistibly toward it. The core of the Sustainable Development Goals is to help the world to move irresistibly towards sustainable development. That means a planet of shared prosperity, of social inclusion, and of environmental sustainability. The history of the SDGs really goes back several decades. One might say more than 45 years, back to a pivotal United Nations conference that took place in Stockholm in 1972, called the Conference on the Human Environment. That was the first conference ever of the UN member states that recognized that the economy on one side and the environment on the other hand were on a kind of collision course, because the increasing weight of human activity on nature was leading to environmental risks of a magnitude and a scale that were unprecedented. 1972 was also the year in which a very important book was published, Limits to Growth, which was the first computer model of wide note that explained that if we were to simply continue to have economic growth with the then existing technologies, the scale of the global economy after a few decades of constant geometric growth would be so large that the burdens on the physical Earth systems would become overwhelming. So Limits to Growth and the Conference on the Human Environment, way back in 1972, put us on the course towards the Sustainable Development Goals. Now, 15 years later, a very important commission was established under the leadership of Dr. Gro Harlem Brundtland, then the Prime Minister of Norway. And the Brundtland Commission established the idea of sustainable development itself. And that was a tremendous breakthrough. The Brundtland Commission defined sustainable development in this way. It said sustainable development is development that meets the needs of the current generation without compromising the ability of future generations to meet their own needs. So this is an idea of intergenerational justice and intergenerational sustainability, that we, the current generation, have a responsibility to the future to manage our lives and manage the economy in such a way that we do not hinder future generations in meeting their needs. That concept of sustainable development was then embraced 5 years later on the 20th anniversary of the Stockholm Conference at what became known as the Earth Summit. The technical name was the UN Conference on Environment and Development. It took place in Rio de Janeiro. The Rio Earth Summit in 1992 adopted the concept of sustainable development as a shared global concept, and it adopted 3 major multilateral environmental agreements. The first, the UN Framework Convention on Climate Change. The second, the Convention on Biological Diversity for biological conservation. And third, the UN Convention to combat desertification, to stop the spread of deserts in the dryland regions of the world. 3 wonderful treaties. But 20 years after that, when once again the UN member states came together in 2012, once again in Rio, in a conference that logically was known as the Rio +20 conference on the 20th anniversary of the Earth Summit, there was a pretty grim realization that not only had the concept of sustainable development not really taken hold, but the 3 multilateral environmental agreements on climate, on biodiversity, and on combating deserts had not functioned properly. They were not being implemented. And so at the Rio +20 summit, government said, what can we do? How can we put sustainable development in front of the world so that people everywhere understand the urgency? And they were operating in the context of another set of goals about fighting poverty that had been adopted in the year 2000 for the 15-year period, 2000 to 2015, known as the Millennium Development Goals, or MDGs. So at the Rio +20 summit, the government of Colombia and then many other governments said, aha, we have goal-based development to fight poverty, the Millennium Development Goals. How about goal-based initiatives for sustainable development, or sustainable development goals? The idea caught on that the MDG era, 2000 to 2015, would be followed by a sustainable development goal, or SDG era, for the period 2015 to 2030. And indeed, the member states in the General Assembly went to work after the Rio +20 summit and began to negotiate what should these SDGs be. Well, they took a survey of governments, and initially the list was about 300 proposed goals. That would not do. So over the 3 years, they negotiated, compressed, chose priorities, aggregated objectives, and so forth. And by the middle of 2015, came to 17 high priority goals for prosperity, people, and planet, or for economic, social, and environmental objectives. And those 17 goals were embedded in the overall commitment to Agenda 2030, and they became, therefore, the framework of cooperation for the period to 2030. We have Agenda 2030 as the broad framework. We have the 17 Sustainable Development Goals, the 169 targets. Now, these goals were adopted by acclamation on September 25th, 2015. And just a few weeks after that, another pivotal event took place in Paris, when on December 12th, an agreement was reached to finally implement in a serious way the UN Framework Convention on Climate Change. That agreement, reached on December 12, 2015, is called the Paris Climate Agreement. It is absolutely bound together with the 17 Sustainable Development Goals. Indeed, SDG 13, to stop global warming, to stop human-induced climate change, essentially embraces the Paris Climate Agreement as the core of SDG 13. So I'd like us in this course to view the 17 Sustainable Development Goals, the broader Agenda 2030 framework, and the Paris Climate Agreement, all as the overarching framework of global cooperation for sustainable development. And our task now, recognizing that all 193 governments have said this is important, this is urgent, this is the shared direction we need to take, that we do our best to understand what will really be needed for the success of meeting these 17 SDGs and the goals of the Paris Climate Agreement. Stay tuned, that's what we're going to analyze next.
Okay, so I hope that gave you a bit of an understanding of the history of where the SDGs come from. They obviously go back 45 years in their development. I know when I was watching that video, one thing that was missing, of course, was any discussion around the specific regions. I was looking obviously for information that would be very pertinent to the African continent and to Kenya specifically. But that's really going to be your job, is to make those linkages. Again, there's offices with, or the ministries within the government are all addressing at some degree the SDGs and have incorporated into their planning for the Vision 2030. And I think that would be very interesting, you know, for you to start to make some inroads to figure out how these have been incorporated in, what the work is that's going on that's related to your own interest. So with that, I'm now going to turn it over. We're going to be hearing from two of our students, and I'm not sure which order they're going to be presenting, but they're going to be talking with us about 2 SDGs. And then next week, we're going to hear from 2 of our other students about 2 additional SDGs. We're going to be hearing about SDG1, ending poverty, ending hunger, gender equality, and also SDG3.
Hi, everyone.
Hand up. I don't know if they needed to ask a question.
I think we'll do it all at the end. I just want to make sure we get through the presentations first. You can put questions into the chat from my part of the presentation, which is the overview, and you can continue to put questions in as well.
Hello. I don't know whether my sound is okay.
It sounds great.
Yes. Yes, it is, Ken.
All right, I begin. I'll be the first student to go. So allow me to share my screen. So thank you for this time. Okay, my name is Kenneth Tonui, sorry. So thank you. My name is Kenneth Tonui. I'm a PhD candidate at Maseno University taking public health nutrition. And I'm also an affiliate student for the SD4H program. So we had 2 tasks as students. The first task was to watch a video on sustainable development. And the second one was to choose an SDG between SDG 1, 2, and 3, and 5, and related to healthcare outcomes, especially in low and middle income countries, especially Africa. So I took the task of doing SDG 2, and I'll do my presentation on the same. So for the first task, we were watching a video by Professor Peter Higgins and Professor Hopkins, which was basically on the UN SDGs and their relation to government policies. So I have a brief summary of my take-homes from the video. So basically, the video emphasizes on the need for learning for sustainability. It questions what is the essence of education as we look at achieving these SDGs. So it really emphasizes on the need for more focus on education that emphasizes on sustainability across all the spheres of life. And finally, the video also touches on issues to do with personal ethics, whereby it really encourages us as a society to take it as part of our moral obligation to learn for sustainability, to do everything for sustainability. So that is my brief summary of the video that we were tasked to watch. That is my brief summary on the same. And then to my main task, which was on SDG 2, which is focusing on zero hunger. So I chose this SDG because it has been part of my interest all along. I've really been focusing on zero hunger as an SDG, specifically on food insecurity. And we realized that SDG 2 has 3 primary objectives. That is to achieve food security, improve nutrition, and also encourage sustainable agriculture. So generally, SDG 2 seeks to end hunger by the year 2030. And when we talk about hunger, we are basically talking about a painful sensation that occurs when someone doesn't get food for a very long period of time. At the end of the day, if you are subjected to food deprivation for a long time, you'll be worried, and at the end of the day, you'll end up experiencing some sort of pain because you are being denied a basic need in the form of food. So, and specifically this SDG seeks to ensure that everybody has access to good quality food. I know at times when you talk about food security, people can say, when I have access to food, to any form of food, it qualifies to be food secure. But there's need to realize that food security comes when somebody is in a position to get food that they can utilize. At times somebody can be food secure, yes, but the body is not in a position to utilize the food that you can access. And in that case, the concept of nutrition security will come in, whereby yes, you have food, but the body cannot utilize the food that you have because it is of low quality, or maybe you are suffering from other illnesses that impairs the body from utilizing the food. And so to the relationship between SDG 2 and healthcare outcomes. So health outcomes, mainly we are talking about changes in health caused by the existing healthcare interventions. And for this presentation, when I'll be talking about health outcomes, the major ones, the most essential health outcomes are mainly morbidity and mortality. Those are the main indicators that will tell us whether the intervention that we have for health issues are really working or not. However, we have other health outcomes such as safety of care, patient experiences, timeliness of care in terms of readmissions, and others. We have other health outcomes that we'll be able to look at as we link this SDG2 with healthcare outcomes. So generally, ending hunger as an SDG2 will mitigate an array of adverse health outcomes that are related to it. And if you take a closer look at hunger, it is amongst the top 10 health risks, whereby it kills more people than AIDS, malaria, and tuberculosis combined. So this really tells us that hunger is a major concern that will always have a bearing on the health outcomes in any population context. And when we look at timeliness of care as an health outcome, and when I talk about timeliness of care, I'm talking about the length of stay at the hospital. People who are prone to hunger or who are suffering from hunger, they are more likely to spend more time in the hospital when they fall sick. This is because generally when people with hunger are sick, it takes a lot of time to resuscitate them. And it may require even the need for therapeutic interventions. And remember, these therapeutic interventions, they're not done in one time or randomly. They take a lot of time, and the interventions can be maybe for 5 days or 7 days. So compared to somebody who is not suffering from hunger, generally the length of stay for somebody who is suffering from hunger tends always to be longer. And in the next few slides, I'll be looking at the specific objectives on achieving food security, improved nutrition, and sustainable agriculture, and their relationship with health outcomes. So I'll begin with food security. And basically, food security is a positive predictor of good health outcomes. Somebody who's food secure has a higher likelihood of being well or being healthy than somebody who is food insecure. So basing on existing statistics, food insecurity is generally more prevalent in sub-Saharan Africa, whereby more than half of the adult population experience moderate and severe food insecurity. And 1/4 of these populations experience severe food insecurity. And remember, as we are measuring food insecurity, most of the time we categorize, we have moderate and severe. So you can either be food secure, and you can either be having moderate food security or severe food insecurity. So sub-Saharan Africa generally bears a significant burden of food insecurity. And when we try to link food insecurity with health outcomes or the adverse health outcomes I was talking about, food insecure populations are likely to adopt negative coping strategies. And when I mention negative coping strategies, I'm talking about scavenging, borrowing, prostitution, and the rest. So generally, these coping strategies are likely to predispose these people to adverse health outcomes. And I'll pick an example of prostitution. So prostitution generally is likely to subject the person who is engaging in it to maybe sexually transmitted infections and other health concerns. So generally, the health outcomes in such populations are likely to be adverse, whereby they suffer mortalities, and in extreme instances, they can die. And also, we need to understand that food insecure populations live in a constant state of worry. People are worried that where will my next plate of food come from? And from our definition of health, I remember back when I was studying health talks about a complete state of well-being and not the mere absence of disease. So even somebody who is worrying, generally we can term them as unhealthy because they're living in a constant state of worry. So when we link food insecurity and health, generally somebody who's food insecure will likely to be unhealthy because they live in a constant state of worry. And if you live in a constant state of being worried always, generally you may end up suffering from mental health concerns. And these have an adverse effect on health outcomes in that people who have mental health issues are less likely to seek health services. Others are less likely to adhere to their medications. So you realize that this food insecurity will cause a vicious cycle between what we are engaging in, and also it can distract what you are doing. In this case, whereby the patient is receiving health interventions, but they cannot adhere to medications. And at the end of the day, they'll suffer adverse health outcomes. And now to the other objective on improving nutrition, which is part of the SDG objective. So this objective also pose a close relationship with health outcomes. In that, most of the time, chronic malnutrition or undernutrition puts population at higher risk of mortality from common infections. Somebody who's malnourished is more likely to be predisposed to infections because they're not taking enough food that can boost their immunity and what have you. On the same note, malnutrition increases the severity and frequency of infections. And remember when I was talking about health outcomes, I mentioned timeliness of care and also readmissions. So in this case, somebody who is suffering from malnutrition, there's a high likelihood that they'll be admitted in the hospital now and they can be discharged maybe for 1 week, and there's a high likelihood that they'll be readmitted because they suffer from malnutrition, which means that they are not taking enough food that can boost their immunity, and they're not getting really enough nutrients to keep them healthy for a long period of time. And on the same note, effectiveness of care and health outcome is affected by chronic malnutrition. This is because measuring the effectiveness of healthcare for a person who has been admitted with malnutrition is likely to be there's a likelihood that the effectiveness of care for this patient may not be effective. This is because when this patient is having a chronic condition, there's a need to also supplement what they're taking. So the effectiveness of care may not be adequately measured, and it cannot be used as a way of really judging whether these people are getting effective care in the settings where they're being taken care of. And also, patient experiences is likely to be jeopardized if they are experiencing malnutrition. This is because of the length of stay and other issues. And I've previously worked in healthcare settings, and what I realized is that patients who are admitted with malnutrition, they are likely to go down than going up. This is because when they are admitted in the healthcare settings, there are other issues that may come in, and they can worsen the situation. So generally, what I'm trying to say is that patient experience as an health outcomes is affected by the nutritional status of a patient. And also there's the disability adjusted life years, that is DALYs. And when I talk about the disability adjusted life years, I'm talking about years of productive life lost due to incapability or disease. And as an health outcome, people who have malnutrition, their normal life is affected. At one point in time, they're incapacitated because they're malnourished. They cannot, maybe they have bowed legs, maybe they lack energy to walk around. So generally, the productive life years are likely to be adjusted downwards. They're likely to suffer from DALYs. So DALYs, or disability adjusted life years, are likely to be lower, to be higher for people who suffer from malnutrition. And in the year 2014, from existing statistics, Sub-Saharan Africa and South Asia are more affected by malnutrition, especially amongst children under the age of 5 years. And Africa still bears a huge burden of malnutrition, whereby 28% of annual deaths can be attributed to malnutrition. And a closer look at the nutritional status of population in Africa shows that Africa bears a double burden of malnutrition. And when I talk about a double burden, at the moment in Africa, we are experiencing cases whereby we have many children who are undernourished. At the same time, we have children who are overweight. And this also applies to the adult populations. So, and also in terms of micronutrient deficiencies, when we link nutrition to health outcomes, people who are malnourished are likely to suffer from micronutrient deficiencies, which we call hidden hunger. It is hidden hunger because we can only, it takes a longer period of time for us to note that somebody is suffering from micronutrient deficiencies when we compare with assessment for macronutrient deficiencies. And this is still a major concern in middle income countries. And finally, to the last objective of this SDG 2, which is promoting sustainable agriculture. Generally, we can promote sustainable agriculture. So, sorry, I've lost power, but I'll continue. So generally, if we promote sustainable agriculture, there's a high likelihood that we'll achieve positive health outcomes. This is because sustainable agriculture will lead to improved productivity, therefore enhancing equal healthcare access. And what do I mean by this? Improved productivity means that these people have income. And when you have income, you can easily access any healthcare need that you want. This is opposed to cases whereby if people practice the traditional ways of agriculture, the productivity is limited and there's no income for them to ensure adequate healthcare access. And also sustainable agriculture ensures that the population are resilient to emerging issues such as drought, hunger, and the rest. So the resilience is improved. Therefore, they can easily cope with emerging issues, emergency situations that are unplanned. And we realize that these emergency situations always have an effect on the health outcomes. And finally, sustainable agriculture adds value to existing food value chains and has the potential of creating jobs, therefore addressing poverty and hunger that have a bearing on the health outcomes for the population. So in conclusion, what I've realized is that ending hunger is really a tough task because of various issues. And the most common issue right now is climate change. Take for example, if we are to practice agriculture so that we can achieve zero hunger, it is really a hard task because of climate change. It is unpredictable. And the situation is really dire in low and middle income countries who lack sustainable agricultural practices, maybe using irrigation schemes. Most of the time, the populations in this context depend on rain-fed agriculture. So they're looking forward for the rain so that they can grow crops. So generally, attaining this SDG remains a daunting task unless we adopt sustainable agricultural practices. And interventions to ending hunger should basically be taught as avenues of expanding options for these people. If these people in low and middle income countries can get more strategies to mitigate hunger, generally they can become more resilient and they can live better lives that will prevent adverse healthcare outcomes. That is the end of my presentation. Thank you.
Thank you, Kenneth. If you can stop sharing for a moment so we can see everybody on the screen again. That was great. I'm going to make a suggestion, Rhoda. Obviously, this is our first week of having content during the seminar. I think, Rhoda, why don't we plan on moving yours to 2 weeks from today or the next session? So we want to be able to have enough time to start to have some discussion and also start to get to know the students. So this is an opportunity to ask questions, clarifying questions around either for any of us to be able to answer around the general concept of the SDGs or specifically for Kenneth around SG2, ending hunger. If you could, when you ask your question, if you could briefly introduce yourself, your name and what department you're in and something about you, and then ask your question, we appreciate that. So we can start to build community over the 2 years of this course.
Great, and I just wanted to make a comment. Kenneth, first of all, thank you for leading the charge and being the first to go on a very, very comprehensive presentation. And I just wanted to say that I thought your presentation highlighted several important things when we're thinking about the crux of the Sustainable Development Goals. First of all, you beautifully illustrated the bidirectional nature between food insecurity, malnutrition, and poor health, both in HIV and other conditions. Second, you started to illustrate some of the different pathways through which food insecurity would worsen poor health. You brought up coping strategies and health behaviors. You brought up nutritional status and micronutrient and macronutrient deficiencies that could contribute to poor health. And you brought up stress and poor mental health. So that was very helpful. And then the final thing that I thought was very interesting about the way you conceptualized it is you were also showing the interdependence of the SDGs. So you can't just look at hunger and poor health, because hunger is influenced by poverty. It's influenced by climate change, and these things are all intersecting and interrelated. So when you come up with solutions, you want to come up with these sort of transdisciplinary solutions that are, thinking across domains. So thinking about, agriculture, sustainability, thinking about having interventions that mitigate impacts of climate change or are adaptive to, and that, engage vast sectors of the population. So I thought that was a very helpful framing. And the last point that I just wanted to make that maybe we could get some more discussion on in later sessions is this idea about sustainable development education is such an emerging thing in health professional schools that really, it's not just in Kenya, but it's really everywhere, that there hasn't yet been in our health professional schools enough attention to this intersection between, climate change, sustainability, and poor health. And there is a new movement emerging on how to create that, and you all can be part of that movement, so that when we go to health professional schools, we think about the intersection between these things. And I will stop there and allow for comments and questions and discussion.
So you can just raise your hand and then you can go off mute and ask a question. So I'll ask a provocative question and I want somebody to respond. So from your perspective, living in Kenya, what do you think of the concept of people, planet, and prosperity? Is that possible? Should that be the focus for Kenya? Somebody has to be brave and go off mute and respond.
Prof, maybe I can respond.
Please.
Yes, that should be the way forward for our case in Kenya, but there are an array of issues in Kenya that are not linked. The social, political, economical, and environmental, they're not yet intertwined together for the intention of maybe providing sustainable social solutions. That would be the way to go, but we feel like the intention, I don't know whether it's from the leadership or the population, but that would be the way to go.
What do you think? I I guess what I'm trying to be provocative about is, as you probably are aware, our current president, we'll soon have a new one in the US, has taken the United States out of the Paris Accord, right? Because of the potential conflict between prosperity and planet, right? Planet being global warming and prosperity, and it's for political gains. So what about from a Kenyan perspective? Are there conflicts? What are the, you see the salient conflicts between planet and prosperity?
Yeah, as I said, we are the political willingness, and there's no link between sustainability and our political landscape and or the people in authority. And I'll give you a case example that maybe will have you thinking. Our government decided to have a railway passing through a national park that is an abode for wildlife. So that one definitely is a conflict, and it dictates that maybe there's no relationship between environmental sustainability and leadership. And this applies to other landscape, be it economic, social, and other contexts that are not intertwined in one way, that they are moving in the same direction.
But also, I believe, though, that a few years ago, the Kenyan government protected a lot of the, is it the Mao escarpment, right? So the forest, and with a part of a lens towards climate change and precipitation and things that were happening in farming, right? So it's not all one side or the other. Kenneth, would you agree that there are people within the government that are really trying to support sustainability while also supporting prosperity?
Yes, we have population who are supporting sustainability, but now there's another population that may be dragging them down.
So maybe to push you a little bit further. So
sorry, Jackie, I think was going to say something.
Oh, go ahead. Yeah.
And just to add on what Kenneth has said, I think I would use the example of the banning of plastics, and comparing Kenya and Rwanda, we find that Rwanda just took the policy and implemented it fully. But in Kenya, we took the policy, but we've not implemented it fully. So there are exemptions for some industries that continue to package in plastics. And I think it's kind of the same conflict of, those companies want to prosper, and and if they have to ban plastics, if they won't use plastic, they foresee their profits going down. And so I think there is the interest and some parts of the leadership pushing for it, but there's also pushback, from industry and something like that.
So Jackie, you're a researcher, and let's say you make central to your area of interest the burning of plastics, and you want that policy to change. So what do you see as a potential avenue to be able to, to move that policy as a researcher?
I guess one thing could be trying to document the negative effects, which on one hand is sort of like known, but figuring out how to bring that evidence much more clearer to the decision makers. Because at the end of the day, I think there's more global evidence on the impact of plastic on the environment, but really not as much of localizing the evidence to. I know we had this quote initially of think global, act local, which I think on one hand sort of you generalize the evidence, but sometimes you also need to bring the evidence back home that the policymaker will engage with and kind of see much more closer to them. So I think that generating evidence around that, but I think I would also agree with Kenneth that a lot of these pushing this forward needs a lot of political will, because for example for the SDGs, putting that together was a role of governments but also civil society, and so maybe the other aspect of research would be looking at how civil society actors, what are some of the pathways that can make them more effective, not only in terms of where we got the SDGs, but how a local civil society organization can be pushing towards implementation of this.
Yeah, and I was thinking a little bit more towards study design. I mean, again, I'm not an expert at all around burning of plastics, but one could look at communities that are downwind from areas where the burning of plastics happens, and looking at, I imagine, respiratory diseases and asthma was probably increased in those communities. So that's the bringing it local, right? And if you identify enough of those communities, then you can bring it to the national attention. And also the attention of the local leaders, and working with civil society, as you mentioned, to help to address. And I'm oversimplifying how policy gets changed, but what I'm trying to do is demonstrate a way that a researcher, an academic, can help to influence policy.
So, Craig, in the last 2 to 3 minutes, should we have everybody just go around and say your name and where you're from in the school?
Okay. So I see in my order, I see Gideon. Sherry, maybe you should call out, because unfortunately my internet's bad. I'm on my phone, so it's going on and off.
Sure. So, Gideon, are you there? Okay, well, let me move to Jackie, and then we'll wait till Gideon gets back in to just introduce yourself and what department you're in.
I'm Jackie Odhiambo. I'm a PhD candidate in the Department of Public Health and also SD4H fellow.
Wonderful. And Kenneth, I think you already had introduced yourself, so I'm going to move to JJ.
Okay, hello everyone. My name is Jacqueline Jacinta Odak, JJ. I'm also a PhD candidate at Maseno University Department of Public Health and a pioneer SD4H fellow, and I'm really excited to be here. Welcome everyone.
Great. Habil, and if I say your name wrong, please correct me. Habil?
Yes, my name is Habil Onyango. I'm a student at Maseno University, Department of Economics. I'm doing Masters. I'm happy to be here.
Great. Everline?
Good evening. My name is Evelyn Ododa. I'm a master's student doing epidemiology and population health at Maseno University. Thank you.
Great. And I see Elizabeth Ayuma.
Yeah, my name is Elizabeth Ayuma from the Department of Botany. I'm also an environmentalist, founder of Green Park Community-Based Organization in Bungoma.
Great. I see HP, but I don't know what your name is.
Hello.
Oh, I think, Gideon, I see you're ready to go. So why don't you go ahead?
Yeah, my name is Gideon Samoya. I'm a master's student in Maseno University. I'm pursuing a course in biochemistry, salinity. I'm happy to be here.
Great. So while we're waiting for HP, I see Dan Omolo.
Hi everyone, I'm happy to be here. I'm Dan Omolo. I'm a student, PhD candidate, and also the SDH affiliate, Maseno University. Thank you so much for the seminar.
Great. And Rhoda, you already introduced yourself briefly. Do you have anything to add? Okay. I see Courier. Oh, sorry.
Not at all. My name is Rhoda Musungu. Welcome.
All right, I see career. Career. Okay, while we're waiting, Luis.
I think that's Luisa.
Oh, is that Luisa?
Yeah.
Oh, and Luisa didn't have an opportunity to introduce herself yet. Do you want to introduce yourself, Luisa? Okay.
Hello? Hello, can you hear me?
Yes.
Okay. My name is Louisa Jerry Ndunyu, and I'm from Maseno University, Department of Public Health. I am also a director in the SD4H program, and I am happy to be with you in this seminar. Welcome, everyone.
Thank you, Luisa. So the last few I see career, we have HP and OPPO. If any of you want to introduce yourself.
Hello.
Hello.
You get me? Yes. This is HP. I'm Charles Bawate from Uganda. I'm a beginning student at Maseno University, School of Public Health.
Welcome. And then just before we go, career or OPPO, do any of you want to introduce yourselves?
Hello.
Hello.
Hello. My name is Crisanto Siamo, PhD student at Maseno University, Department of Business.
Great. We have a nice diverse group here. This will make it very interesting to get all of your perspectives.
Thank you.
So anyone else want to introduce themselves before we close?
So I just want to remind people that and Rhoda will be doing this. Our next session will be December 3rd, starting at the same time, and we'll be hearing from likely 3 of our students on SG1, SG4, and SG3. And again, like Sherry, I just want to echo what she's saying. It's really fantastic. You must represent like 8 or 10 different departments, which is really what we're trying to get. Is all these different perspectives between the various disciplines, and it really is going to start with you as the students.
Well, welcome everyone. We're thrilled to have you, and we'll look forward to seeing you in 2 weeks' time.
All right, have a good evening, everybody.
Thank you, and thank you to Kenneth.
Thank you, and thank to Kenneth. Yes, yeah. Bye bye.
Welcome all. Bye.
Bye, everybody.